With Gauteng the epicenter of the third wave, 60 military medics have been roped in to assist struggling healthcare facilities. The number of infections has already breached by over 2,000 the cases recorded in the second wave.
Our province is under fire. This place is burning with coronavirus. You can see for yourselves that the numbers relating to the third wave are way above where the numbers were during the first and the second wave. The infection rate, the test positivity rate, but also the hospital admissions are just doubling up almost every other day. If we have 100 beds today, there's no guarantee that we will have those 100 beds at the end of 48 hours. So the number of beds that we have now, looking at especially the numbers, the increase in infections that have happened just in the last 5 days, those number of beds are regarded as taken, even if they are not yet occupied, because there is a 7-day lag.
And it seems a higher level of restriction for the province is not off the cards.
The COVID pandemic in Gauteng is really raging, and I can't say that what we have done is enough. So I can't rule that out. That we may need more restrictions, but it is something that's going to be discussed.
And this is in part why public and private facilities are at 70% capacity.
Yesterday, we had 1,470 patients admitted in public sector. And then in the private sector, it was 3,448. Total of patients admitted in the hospital in Gauteng, including private and public, is 5,218. And then with regard to capacity, so where we're sitting now, we are at 40% COVID patients admitted. And then when you include the PUIs plus COVID, we're sitting at 72%. 72% patients admitted in Gauteng as we're standing here.
Now help has arrived. The military contingent will alleviate the pressure.
When we say we deploy a number of soldiers, we deploy soldiers in task groups and task teams. The numbers cannot be displayed to the public, but a task group can nurse at least an average of 60 to 100 patients. But because of rotation of shifts and the fact that we are supplementing an already existing organization, we cannot then say how many patients in ratio of how many personnel. But we are deploying a medical task group which is consistent of 60 people in the interim.
Nursing Union DENOSA has welcomed the deployment.
It has been one of our longest resolutions that we want the issue of understaffing to be addressed. So additional hands are indeed welcomed. As DENOSA and Gauteng, we do welcome the deployment of the militaries because it's going to assist our members in terms of dealing with the crisis that we're facing.
The medics will be deployed in the next 48 to 72 hours. Well, the province says the situation is worsening, with beds filling up rapidly, and even those still empty are regarded as taken due to the escalating number of infections. The military medics deployed here at the Chris Hani Baragwanath Hospital will be vaccinated on Tuesday. Chris Lewis, SABC News, at the Chris Hani Baragwanath Hospital in Johannesburg.